I'm Dr. Nick Plowman. I'm an oncologist at St Bartholomew's Hospital here in London. As everyone knows, prostate cancer is an important and common cancer amongst males in this country. And the oncologist and indeed the patient should divide the types of prostate cancer that present to us into three groups. Those where the tumour is localised within the gland, those where there's some early spread just outside the gland but still within the pelvis, and those patients who sadly have developed a spread further afield, and that's usually to either lymph nodes or the bones. The treatment options for prostate cancer depend on the stage, whether it's early or advanced. Let's take the patient with the disease that's confined within the gland itself. For them, there are often several treatment options with an equivalent chance of cure. The first would be surgery. Secondly, there are the radiotherapy options, and then there's external beam radiotherapy, and then there's brachytherapy, where radiation seeds are placed within the prostate to deliver a very high dose of radiation focally within the prostate. Where the tumour seems to have breached the envelope that surrounds the prostate, the so-called prostate capsule, but doesn't seem to have spread further afield, then the treating clinician will make use of primary hormone therapy. And where the disease is through the capsule of the gland, we use the downstaging, as we call it, by anti-hormonal methods before coming in with usually beam radiotherapy. Once it's gone through the capsule of the gland, we consider the patients less suitable for surgery, or indeed prostate brachytherapy, or indeed cryotherapy or cyberknife, or certain of the other focal techniques that we've described as being curative for those patients whose disease is within the gland itself. For patients with what we call locally advanced disease, that is, the disease has spread through the envelope that surrounds the gland, the capsule of the gland, but hasn't spread distantly. We use a short period of anti-hormonal treatment prior to beam radiotherapy, and then usually carry on the anti-androgen or testosterone suppression for a period of 2 years.
For information, help, or if you just want to chat, call the Macmillan support line on 0808 808 0000 or visit macmillan.org.uk.